My name is Selena Ramirez. I picked physical therapy. So my target population, I picked nursing students and future registered nurses because I was going to tell my whole group for clinical. Alright, to start off, I had made like this brochure with physical therapy, and I included pictures, and I have my APA back here. But I got these from the Word doc, so it has like PT, and it has a medical emblem, and then here's a physical therapist working with a patient that looked like he got burned, and then here is like, would be an example of like a doctor and physical therapist who work side by side in the nursing care team. So my first section, PT and RN working together. I have a little quote here by Winston Churchill. The price of greatness is responsibility. So the role and responsibility of physical therapist jobs is looking at the functional mobility compared to before when they were admitted into the hospital and now that they are in the hospital. They are looking at the cardiovascular ability. They also look at the patient's safety awareness when it comes to like how they walk, if they're unsteady, if they don't have a steady gait. They're the ones that always find patients who like shuffle when the RNs never really notice it when they take them to the bathroom or the aides. So they look at the whole picture, whether the patient is orthostatic versus balance abnormality. So they're the ones I've seen. I work at a hospital as well as a tech, and I've seen patient physical therapists go in and evaluate a patient. They're like, yeah, they come out and they're like, yeah, they're not orthostatic. It's more of a equilibrium problem, like from the ears, that's inside the ear. So they're the ones that actually figure that out. They also give recommendation if they should get more treatment, such as rehab, to gain their strength before returning home. They are watching out for the patient's safety and to determine if they are healthy and strong enough for daily living. The doctors look for the recommendation when it comes to patients, and what they have to say is significant, because I never realized, I saw the team, but I never realized how important their opinion really does matter in patient care after doing this. Some background requirements, which I did not know. Here I would ask the group, like, what do you think is the highest degree a physical therapist has to get to work in a hospital? And I didn't know, but so their background requirements, they first earn their bachelor degree in a health related field. Then they can complete a doctor of physical therapy degree program. So they actually get like their doctorates in physical therapy program. Once they meet the state licensing requirements, they are able to complete the residencies. And then I think I had to ask one of the PT girls, and they're like, yeah, it takes a lot of hours. And then once that's all completed, they obtain their board certification. Physical therapist has to complete an abundant amount of school and hours to be considered a physical therapist, which I never thought that they do, which is pretty surprising to me, because I feel like they deserve a little bit more accreditation than what they get now in the hospital, because they actually really did go to a lot of school and they know what they're talking about. And sometimes patients are like, what do you know? But a lot of the times they recommend something that the patients don't really agree on, but it's for their safety. So I could see why it could get hard for physical therapists to do what they do. But the professional perspective on the importance and the existence of nursing support. So that's very important. One of the main importance is progression, I believe, for the patient. The physical therapist can give the nurse the most beneficial way to have the patient ambulate, which is true, because I've seen like nurses get brand new patients. They told them report, oh yeah, they're like a ×1, they're fine. And when it comes to the patient getting there, they have to go to the bathroom. And they're like a hard times too. And then it's in the nurse's judgment to have a PT eval. And then once PT evaluates the patient, they come and tell us, and they're like, no, you know what, they're actually really ×1. It just gets them going, blah, blah, blah. So what they say is very important, and how the patient ambulates, because I feel like it's a little different for nurses, because most of the time it's just like nursing care, and I don't feel like they work with the patient as much as physical therapy does when it comes to physical therapy. Like they actually like work out their legs, see how strong their legs is, rather than us nurses when it comes to like patient care. We just get them cleaned up, get them like freshened up, showers, brush their teeth, let them walk around the unit, but we don't really work the nitty gritty on exercising in the hospital as much as they do. So they help ensure that the RN mobilizing for progression. The physical therapist can identify changes in patients that the RNs have missed. So they can also tell whether they're weaker or stronger due to having to work with them during the course of their stay. So they get to see them every couple shifts. So they really know like their baseline and when they change, rather than a nurse who just got them today and they haven't had them before, even though they've been here an entire week. So they really do help catch changes in patients, which is important because that could help determine treatment, and then the doctors get notified a lot sooner than the nurse who just got them today and then they're getting them tomorrow and then they start declining. So they're able to catch a lot sooner than what the nurse would if they haven't cared for them before. So I believe that's very important, and the existence of the nursing support. It is also, as I said before, the nurse's judgment, and they should recommend an evaluation for physical therapy. The teams for rounds in the hospital consist of an RN, case manager, physical therapy for rounds, which I never knew before. And I always wondered why physical therapy was with the case manager and nurses when they run in the morning, but it makes sense because they are the ones who are able to determine whether they should go to skilled facility, rehab, and those kinds of recommendations are important, especially to prevent falls and having readmissions into the hospital. So those three decide based on the three judgments where the patient is going when they are discharged. So it's very important. The efficacy of the profession on patient outcome. That's pretty important. So I believe it's progression, education, and knowledge. Physical therapy is there to educate patients, educate how to use, for example, educate how to use a front wheel walker, a cane, or crutches if they have broken a leg or an arm. They educate nurses on the best way to ambulate around the room, especially if they have precautions. Like one example, log roll. Like the patient, if they have a spinal injury, sometimes it depends on the nurse's knowledge as well, but their recommendation is very important on the orders. So they're the ones that help determine how they ambulate for the patient's safety and the staff. They're the ones that recommend whether they should go home with assistance or to rehab. They're the ones that help determine patient outcomes. The doctors take the recommendations and then write the discharge orders based on the recommendations. It's very effective work that they do in the hospital. They have a huge impact in the patient's plan of care. Physical therapists teach patients how to prevent or manage their conditions to achieve long-term benefits, which is very vital. So, perspective of how nursing views the significance of the specific profession related to ongoing patient care and patient outcome benchmarks. It is an important component of physical therapy in the plan of care in patients. They are important in direct management of individual patient care for the opportunity that they provide the profession in collectively comparing care and determining effectiveness. Given the importance of the patient's participation in the healthcare decision, which empowers patients and improves services and health outcomes. So basically, physical therapists are able to give them that empowerment by properly educating them on their care. So when they properly educate them and the patient does want to do better, does want to get stronger, the therapy is very effective. They can and they will take their advice. They offer exercises for patients that are in bed and in the hospital. We have like a lot of patients and it takes times one and we're really swamped. We probably won't get the chance to walk them around like we should. So the physical therapists are able to give them exercises to still do in the hospital, even though they're not able to go walking around, which is very important because physical therapies focus on different part of strength rather than the norm, like walking, lifting things. And I noticed they do try to set up total care patients just to try to get them even stronger when they haven't been up for months, which I can now see why after learning about all this. The outcome they want for the patients is to get back to baseline or above. They take their safety into consideration and they are vital to the healthcare team. I feel like we need to acknowledge that a little bit more. And I feel like they should be able to express that they have gotten that much education, And I feel like they should just be, I feel like as student nurses and future RNs, we should be educated about how important their judgment is in patient care and how we have to collaboratively work together with physical therapy, occupational therapy, speech therapy, respiratory therapy. So we're all a vital team. And then here I have included APA references. And yeah, that is all.